America is home to 33 million small businesses, the beating heart of communities across the country.
And proof that the American dream is still alive.
This is a show about those dreamers and doers and the communities they serve.
Their real life stories.
Their struggles and successes.
Their grit, determination, and passion.
And the people who fight
to keep their American dream alive.
I'm Alfredo Ortiz.
I'm Elaine Parker.
And it's time for another episode of Main Street Matters,
America's small business megaphone.
Hi, and welcome to Main Street Matters, America's small business megaphone. I'm Elaine Parker, the president of the Job Creators Network Foundation.
And I'm Jordan Bruno, vice president of Job Creators Network.
Please subscribe to the show at salempodcastnetwork.com or wherever you get your podcast from. Today, we're excited. We're joined by Rob Burgess. Rob is the executive director of Americans for Pharma Reform. Americans for Pharma is a grassroots organization informing and engaging all Americans about high prescription drug pricing in the USA. He's currently on a part of a Big Pharma Bus Tour and is joining us to talk about the pressing issues surrounding Big Pharma and the need for reform. Rob, thanks so much for joining us.
Thanks for having me, guys. I'm excited to be here today.
Well, tell us about your organization, how long you've been around, and what you're trying to accomplish in this bus tour and where you're going to.
No, I appreciate it. You probably introduced us better than I could even hope to do as the executive director. But Americans for Pharma Reform is exactly like you said. We're a grassroots organization of concerned American citizens that realize that this prescription drug issue that we're facing is not simply a generational issue that is in our past, that it's something that every American alive today and alive in the coming years is going to have to face unless we start putting some guardrails up. And so we are on, like you said, the midst of a nationwide Big Pharma Bus Tour, currently sitting in Michigan. This is our fourth state. And we are educating people exactly about how Big Pharma is pushing competition out of the marketplace, how they're driving costs up for the American consumer while lowering them for other prescription drug users across the globe. And then additionally, how these CEOs and these C-suites are prioritizing wealth before health, right? And really putting profits before patients. And we really think that right now people are paying attention. People are really focused, in that if we can educate them, highlight some of the things on this issue that they might not be aware of, this could very well be a deciding issue for people as they're coming up towards the election here in November.
Tell us what you're hearing on the ground from people.
Sure. We started in Arizona, and it's supposed to take us through Arizona, Montana, Wisconsin, Michigan, Pennsylvania, and we're also talking about adding North Carolina onto that list as well. And every stop that we take, we have gone from sporting events to big box grocery stores to 55 plus communities and senior centers, as well as parking outside of hospitals. And everywhere that we've gone, we've heard an overwhelming chorus that the American people are fed up with the high cost of prescription drugs and that there needs to be a better way forward. However, a lot of Americans don't know that they are subsidizing the rest of the world's prescription drug costs. We pay on average 5 to 7 times more than the rest of the developed world for the same prescriptions. And that is simply unfathomable when you think about how much this country, whether it is taxpayer dollars that have gone to these companies to fund R&D or simply the high cost of prescription drugs that we already pay, this country is really underwriting everything that Big Pharma is doing. You would think that they would prioritize the patients in this country over the patients across the rest of the world.
Rob, this issue has become so politicized. It's really hard to know what is true because, unfortunately, it has become such a Republican and Democrat issue. Can you really tell our viewers what is the problem and how we got there?
I think that the problem is twofold, right? And really, if you start digging deep, you'll find more and more micro problems, right? That we think that we could possibly solve over the next 10, 15, 20 years. But us as an organization, we're really focused on how can we address 1 or 2 or 3 things over the course of the next 2 years. Let's make some significant changes now so that we can continue to fight the fight down the road. I'd say a big key of what the problem is today is this revolving door between pharma and the bureaucracy that in the federal government that oversees pharma, right? Currently, you could be a pharma lobbyist or an employee of pharma, then go in and work at the FDA, which is responsible for approving and overseeing the drugs that you might have been working on or selling. And then after your time at the FDA, go right back into your job with Big Pharma again.
So the problem that I'm hearing is the high cost of prescription drugs. So is that a true problem? How come when I go to the pharmacy, I can get, amoxicillin for my kids for $6, but then I hear on the other side that people are being bankrupted by just give us a scale of the prescription drug cost crisis.
You're absolutely right. Prescription drug cost is another aspect of that problem that I was going to get to. Amoxicillin in one family, one community, one set of insurance could be a certain price, but then you start talking about the underinsured or the uninsured and how they are now having to pay a different price point. So we are talking to pharmacists too. Part of the issue is they have negotiated prices with the pharmaceutical companies and also with the insurance companies. So there could be a drug on their shelf, a generic, that they know they can sell to a patient for $5. But the moment that patient presents a prescription from a doctor's group, or the moment that patient presents an insurance card, they have to charge them the $25, the $10, the $15 copay. They can't even offer them that generic if it wasn't what was expressly prescribed for them. And so there are a lot of things that we need to do that can help drive costs down. Another thing that can drive costs down is preventing Big Pharma from advertising directly to consumers. We're one of the only countries in the world that allow that to happen, because now, as a consumer, we're getting all these television ads and all these digital ads and all these radio ads telling us this fairy tale. I was a small business owner wanting to open up a juice shop, but I had this disease. But thankfully, I went and got this prescription by name, and it was able to help me achieve this dream. Well, instead of relying on our doctors, the medical professionals who know us, know our health history, know our family's health history, and can best make decisions with us that are best for our health, we are now going in asking for brand name prescriptions that might not be the best fit. And so we need to get rid of that direct-to-consumer advertising piece as well. If we do that, costs are going to drop because they no longer need to be spending millions and millions and millions of dollars on TV to advertise the American people.
Why are drug costs so high? Why can't people afford their insulin?
I think it's part of the reason is they look here at the American system and realize it's something that they can continue to squeeze the rag and get as much out of it as they can. Rather than the federal government putting up guardrails in this situation, they've kind of allowed the Big Pharma to create a monopoly. And in that case, we are subsidizing the research, whether it is through helping fund things through the federal government, funding research through Medicaid and Medicare, or even just through our individual purchases. We are funding the research that they're then turning around and selling the same prescriptions over in Europe for 5 times less than they are here in the United States. There was a CEO of a pharmaceutical company that testified before Congress a few months ago. They were specifically asked, this one drug is, you charge $35 here in the US, but you charge $7 for it in Europe. Are you making a profit on it in Europe? And their response was yes. So really, this comes down to us needing to force the pharmaceutical companies to recompete in a free market. And the way that we ensure that happens, put some guardrails up. Stop allowing them to advertise directly to consumers. Let's get rid of the evergreening patent process where their most profitable drugs, as the patent protections are starting to expire, they make one non-consequential change to the formula or one small change to that patent that might not change the overall performance of the drug, but they get to increase the patent protection on it. That prevents generic pharmaceutical companies from competing against them with the same drug, right? So we need to go ahead and force them to start competing in the free market that allowed them to thrive in the first place. If they continue to succeed, it's meant to be. But if they're starting to lose profit share, lose market share because these generic manufacturers are able to step up and play a role, then we can truly see that their monopolistic practices were more harmful to the American consumer than anything else.
What about the argument that I've read about the pharmaceutical companies don't have any input on pricing the drugs to patients, and kind of where PBMs fall into that? Because it seems like there's maybe a couple of chains in the link that should be looked at. And PBMs, I think a lot of people don't understand what PBMs are, pharmacy benefit managers. Can you kind of give our audience an overview of what the PBM is and where they are in what chain, what link in the chain they are and how they play into the being a driver of the cost of medicine?
Sure. PBMs, they play a role that basically connects pharmaceutical companies through them to all pharmacies almost directly, right? And they help with price controls to the best of their ability. Pharmaceutical companies do play a role in that, right? They set a minimum standard here in the market that they say, okay, this drug cannot sell for less than this unless this is tacked on top of it, this insurance here, and here, right? I would say PBMs play a role, and it's probably something we need to look at a greater aspect to, but I don't think that it's an immediate fix. That could be something that needs to be addressed and fixed 5 years down the road. But I think the most important thing that we can focus on right now is ensuring free market competition and putting some guardrails up at the federal level that closes those loopholes from, lobbying for pharma, becoming a government bureaucrat and going back, and making sure that direct-to-consumer advertising is limited, if not completely, eradicated. The role PBMs play, should be looked at closely. But I do not think that it's necessarily something that we would be able to change with advocacy or action here in the next year or two. It's definitely something we're going to have to study longer, further, and see how their role can either significantly change to help address these concerns, or what they can do from their side of the equation to help bring Big Pharma into check.
What about so the reason why I ask about the PBMs is, one, I think people don't understand what role they play and who they are, because they're kind of the hidden middleman, which as soon as you hear middleman, you think cost driver, right? But I know that the pharmaceuticals have, issued the rebates that go to the PBMs, and they're not, what I read is that they're not passing those rebates onto the patient, and that's helping drive the cost too. And I'm just curious, why does that happen that way?
So that's not something that I specifically have seen as common practice among PBMs. Again, whether you're talking about any industry, right? Whether we're talking about prescription drugs, we're talking about law enforcement, we're talking about the legal profession, right? Even, looking at, just business in general, a few bad actors set the tone and the reputation for the whole industry, right? And so I do not think that practice is standard amongst PBMs. Now, it very well could be happening, but the few interactions that I've had with PBMs and how they pass down, whether it's rebates, discounts, or deals from the pharmaceutical company directly to the consumer through the pharmacy, it's pretty seamless. And the biggest concern is the negotiations that these pharmaceutical companies have through their reps with doctors' offices, specifically medical groups and insurance companies. Because the last thing that you're getting into then is a doctor feels like they have to prescribe only Pfizer drugs because that rep is in their office 3 days a week providing lunch to their employees, right? And so if we can, again, force there to be more competition in the marketplace, we think that we're going to see lower prices across the board. And it could very well take, the few bad actors that could be giving a lot of confusion in the marketplace about PBM's roles. It can completely negate them out.
Rob, Kamala, one of her big parts of her campaign is price controls on prescription drugs. Do you think that's part of the solution?
We really don't think price controls necessarily is a solution. When we think price controls, we think about we're stifling a market. That's not something that we think is ultimately going to help the American consumer thrive in this space. What we would rather advocate for, and what we are advocating for through our petition on our website, people signing the bus on the bus tour, and hopefully elected officials signing our pledge, is that we want to put guardrails up that force pharmaceutical companies to put American patients and their interests first above their profits. That doesn't mean that American patients come before Canadian patients. That doesn't mean American patients come before European patients. It means that we need to be looking at all patients equally in the scope of how we price these pharmaceuticals, regardless of their geographic location. If you start talking price control, right, then we're starting to talk about, the government's going to come and have to step in and either force these private companies to hit a certain standard or subsidize it in order for a price control to hit. Ultimately, the American consumer is going to feel that in their pocketbook somewhere, some way down the line. And more importantly, small business owners are going to start feeling it too, because they're going to start seeing insurance costs skyrocket for them if the government has to come in and create an even larger subsidy in order to force specific price controls.
Right. And then what about the Mark Cuban model of selling prescription drugs directly to consumers? He seems to have been able to develop really significant savings. What do you think about that as a potential solution?
So it's a very interesting concept, and I think it's definitely something that we can continue to explore. Obviously order by mail prescriptions have been around for a while, but this online marketplace is something that's very interesting. I think it's definitely part of the conversation, right? As we're looking at these solutions, we have to look at everything holistically, right? Mark Cuban's one of the smartest guys in the world. He finds unique solutions to problems that a lot of people haven't even thought about, brainstorming or wireframing out. So let's fold him into the conversation, right? Let's get him to sit down at the table with the people at the FDA. Let's get him to sit down with pharmaceutical companies. Let's get him to sit down with doctors, and let's say, hey, how can we cut the fat, right? How can we go ahead and start prioritizing health before wealth? And ultimately, I think that if we can get all the stakeholders at the table and have them agree and align on a specific mission, I think that ultimately they're going to come to the right outcome for the American people.
Is there any legislation that's been developed? Are you working with any folks on the Hill?
So we're very early in that process. We're engaging with those elected officials and candidates currently, asking them to sign our pledge, the Health Before Wealth pledge, that essentially says that they're going to, hold Big Pharma's feet to the fire, right? That they're going to encourage Big Pharma to prioritize the American consumer so that we are at least on par with the rest of the world when it comes to prescription drug pricing. The next step, right, is to then work with those members of Congress that show that they're supporting us in our mission, to then start taking small bites of the apple. And I think the next small bite of the apple is by putting some more regulation around the FDA. The leaders of the FDA that specifically oversee the approval process for prescription drugs, as well as tobacco and food testing and things like that, the specific leaders of those smaller agencies within the FDA are not confirmed by the United States Senate. That's probably something we need to look into and change as quickly as possible. When you have an unaccountable bureaucrat making decisions as drastic as what drugs can go through FDA testing, what drugs are approved by the FDA, what can hit the market when, and at what price point, those people need to be accountable to Congress, whether that's the Senate or the House, so that you, me, Jim in Grand Rapids, Marvin in Hamtramck, Michigan, right? They now can hold an elected official accountable when something does go off the rails, when a monopoly all of a sudden pops out of nowhere and there's no way for us to fight it down. That's when you need that elected official to be able to point to and say, hey, you approved somebody at the FDA that made this possible. What are you going to do to fix it?
Interesting. I know, obviously, pharma would be against any legislation, but who else would sort of be challenging this? Would PBMs be challenging the type of legislation that you need to bring forward to reform pharma, or would they see it as a positive in the supply chain for medicine?
I've not had that conversation with a PBM, and that makes me want to do some research out to see where exactly they would fall on this issue. On its face, I agree, pharma would definitely be digging their heels into the grass, but I think that we also see a lot of support from other outside groups, right? We'd see support, I think, from the AARP. I think we'd see support from probably some more senior focus groups, right? Citizen 65. I can see also us seeing support from states where they have high senior populations, where their medical system is probably overloaded, and their state Medicare and Medicaid programs are probably at their full capacity. And if they could see legislation like this come to fruition, it could probably help ease the burden across the board, not only at the federal level, but also the state level. So I think this could have broad support from other outside groups, other entities, but also from the state level as well.
Okay. Well, Rob, I mean, I think it's super interesting what you guys are working on. We've done a lot of bus tours ourselves, so I know it's a lot of fun, but it's also a lot of work. So hats off to you and your team for what you're pulling off and how many states you're heading to. And thank you so much for joining us today and taking the time to explain this issue to our listeners. And thank you to our audience for tuning in. Main Street Matters is part of the Salem Podcast Network. New episodes debut every Wednesday and Friday. You can subscribe to the show at salempodcastnetwork.com or wherever you get your podcast from. And we'll be back soon with another episode.